Um, Thank you. We have 3 passed. We'll go ahead and call the meeting to order. Fortunately, we don't have anything other than the consent agenda to vote on, and because we don't have a quorum as of right now, I'm gonna hold that over. Good morning, all. This is Jody Barker, AAA Director. B, our chair, is out sick, so be thinking of her. And Chris, our Vice Chair, is on the road back from, I think, some family in Texas, I believe it is. So what we'll do is we'll hold over the consent agenda. I don't see our special speaker either. So 10:15. Okay, perfect. Thank you. So our speaker will be on at 10:15. So we can go ahead and get through some of our business and updates. And so we're going to just jump all over the place today. So good morning, everyone. I'll go ahead and do quick introductions in the room. Myself, Jody Barker, Area Agency on Aging Director. We have Melissa Martz, PPACG staff, Melody Hannah, formerly known as Dowell. So you're going to start hearing Hannah. All right, we have a quorum. Yay. I see Jen, you did it. Thank you. So we have Melanie Hannah in the room, also PPACG staff. We also have, oh, my glasses. I'm just, after all these years, yes, this is embarrassing. So Cynthia Margiata, I'm sorry. How can you forget her, right? So thank you for being here in the room with us, Cynthia. I appreciate it. Online members, I see Debbie and Eric and Maria and Jen and Marilyn. Thank you so much for being here. I see some other guests as well. Sharon from Teller Senior Coalition, Lori and Jason from Silver Key. We also have Jenny Danner from Park County Senior Coalition. So yeah, this is great. Thank you very much, everyone, for being here. So now that we do have a quorum, we will go ahead and review the consent items. That's both the agenda for today as well as the minutes from last meeting. We'll vote on them as a single consent item. Is there a motion to approve as written?
I'll make a motion to approve.
Thank you, Debbie. Is there a second?
I second it.
I heard Marilyn first. All right. So Marilyn, we have a second. Is there any discussion or any items that need to be pulled for discussion? All right. Hearing none, may I have all in favor say aye?
Aye.
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 Thank you. Any opposed? Like sign? All right. Consent items pass. We're moving on to the public comments. This is a time for folks to mention anything or present anything that's not on the agenda. Good morning, Rosemary. Glad to see you here. Do we have any public comments either online or in the room?
I do, Jody.
Hold on, Marilyn. Public comments is for non-board members, so we'll get to you. So
Okay.
yeah. All right. Hearing none, we're gonna keep moving along. We have no action items this month, but we do have a lot of exciting updates. So we will continue on with that. I'm watching the clock because our special speaker will be coming in at 10:15, joining online. Is that correct, Melissa? All right, great. So we're going to go ahead and continue. So we'll pass over the presentation. She'll be joining us shortly. 5B is our membership subcommittee. This is where I would like to ask Melissa actually to guide the conversation. Melissa and Rosemary to guide the conversation and have some report outs and some updates for us.
Hi, everybody. So our RAC members have been quite busy for the last couple of months, actually probably over a year, some of them. And just last Friday, we had 2 really exciting events happen on the same day of all the crazy things. And so the first thing, I had spoken with Rosemary a little bit, and I don't know if Rosemary wants to jump in and kind of talk about it and then turn it over to Marilyn and Debbie. But the first event that happened was we did an outreach event at an Anthem Medicare event on Friday in the snow, or actually in the rain, and then turned to snow later. And then the other event was the Heritage Food Box distribution, which I'll circle back and kind of share a little bit more on that. So first, I don't know, Rosemary, if you want to say a few words and then turn it over to Marilyn and Debbie for the kind of Anthem event. And then I'll jump in with Heritage Food Boxes.
No, I'll just turn it over since I didn't attend either.
So I'm hoping, Marilyn, you might share a little bit, especially about the name that you got to bring back as a possible RAC member. And then Debbie could jump in too.
That was exciting because I approached them because no one else was talking to them and they were just sitting there by themselves. And to my great surprise, she was interested in what we were doing. And so it was, I think that's the first time I've ever really talked to somebody that was asking me questions about how to participate. So I hope that this will be a positive in our direction. Debbie, what do we have, about 12 yellow books out?
Yeah, it was not as well attended as they had said it was going to be. They had invited, I guess, 25 to 30 people, but it was a miserable looking day, rainy and damp and cold. So, you know, there were about 11 or 12 people kind of wandering around. In fact, 2 of my neighbors were there, which was interesting. But yeah, we did hand out about 10 books to people, kind of try to explain who we are and what's included in the books. Yeah, but we left, I think most people actually left early. I mean, it was supposed to go like 9 to 1. And I think we left at like 11:45 maybe, because there weren't any new people coming in.
All right. Well, thanks, you guys. We are eternally grateful that on 2 days, one day we would have 2 events, and we actually had RAC members at both events. So thank you to you guys. Very excited about that. And then the next thing I wanted to talk about is the Heritage Food Box distribution that happened. So some of you guys remember quite a while ago, Cynthia Aki, she was on our Regional Advisory Council. When she stepped off, she had shared with Joe Ruth that she was hoping that our Regional Advisory Council might do more for underrepresented populations of people of color. And so we started a group that was meeting once a month on Monday, like the 4th Monday of the month, to kind of just talk about how to do better outreach to that population of folks, because we didn't have good representation on the RAC, and we also didn't have you know, all those individuals actually calling us asking for services from the AAA. And so we wanted to kind of do a little bit more around that. And so over time, one of the ideas that Cynthia Aki had was that it would be great to do a kind of comfort food distribution to older adults in different cultures. And so in January, the Leadership Pikes Peak group with the Women's Community Leadership Initiative decided to sponsor an opportunity to give out Heritage Food Boxes to folks. And so from January until May 20th, we had fast and furious meetings trying to figure out how to make this happen and coordinate it. And we got donations from natural grocers, another restaurant food distributor, Savory Spice. And then we used Area Agency on Aging CARES Act money to help cover the other costs. And we actually did a distribution on May 20th out of Centro de la Familia. And so I'm going to do a quick little slideshow with a couple of pictures. And then if people have a couple questions, that's great. And then if not, we can jump in and have Jess, who's with the Metro Denver YMCA, do her presentation. But I'm going to go ahead and share this PowerPoint here in a second. So bear with me as I share the screen. All right. So are people seeing the PowerPoint presentation?
Yep.
Great. All right. So here we go. And so again, this happened on May 20th, last Friday, when it was pouring rain. And our goal was to serve 120 people. So we bagged up about 120 bags. And not only is it Older Americans Month, but it's also Asian Pacific Islander Month for May. So here's the picture of kind of the beginning stages of it. Some of the women that you see in the picture there are women from the Women's Community Leadership Initiative. Some of you will recognize Cynthia Aki front and center there. Our staff person, Laura Cruz, she came, and this was in the evening at Centro de la Familia. The food we delivered the food. RAC members B and Joe picked up the food at Natural Grocers along with a couple of the WCLI gals and brought it over, and we started bagging food. And here's an example of a couple of the food boxes that we did. So we had an African American food box, we had our neutral box, we had our Latino and our Asian Pacific Islander box. So you can kind of see some of the items that got put in these different boxes. We tried to have some protein, so either canned tuna or canned chicken. We had some fresh veggies. We had beans, sometimes fresh beans, sometimes canned beans, along with different varieties of rices, depending on the culture, whether it was jasmine, short grain rice, whether it was long grain rice, whether it was brown rice. And then in the African American box, as well as the Asian box, we actually had collard greens. So on the picture, our collard greens didn't end up in our Asian box in the picture, but they ended up in the box that was handed out. And then we put our yellow book and all kinds of other resource information into the boxes as well. And here is one of the rooms getting filled up with the bags. Again, you'll recognize Cynthia Aki over there in the corner. And then here is the bags flowing out into the hallway because we have so many. And so what you see on the left is the before picture, and on the right is the after picture the next day on Friday. By 10:30 in the morning, pretty much all the bags were gone. And we were supposed to start at 10. We, of course, had people arriving at 8. And so we were done actually by 10:30. But we stayed until 2 because, believe it or not, we had people trickling in all day long until 2 o'clock. So we did stay the whole day. You can see a handful of a few other little bags that were still there that we were able to give out as people did trickle in. But for the most part, we were done by 10:30. All those bags were on their way with older adults to their homes. And so again, a special thank you to some of the folks you can see in the picture. Joe Ruth, she was there with us on distribution day. She had a great time. Cynthia Aki to the left, far to the right is Lucia, who is the executive director for Centro de la Familia. The gal standing next to her is the founder of Grescio Housing. And so she came and she specifically asked for an Asian box. She wanted to have comfort food from Asian culture. So she picked up an Asian box, and then the gal standing next to her is a staff person who works at Grescio, who was with the Women's Community Leadership Initiative. So an amazing day, a lot of work leading up to it, a lot of thank yous to a lot of folks who really made a big difference. And we did our first real outreach to multiple communities of color and are looking forward to making connections with them. We have phone numbers from every person that we distributed food to. And so we can be calling and checking in on them, seeing how they're doing, and looking forward to possibly RAC members, Commission on Aging members, as well as just folks coming and getting more services from the AAA and our contracted providers. So stay tuned. We're also looking forward to doing another distribution similar to this in September. So if anybody wants to get involved, you're welcome to join as well. And that's what we did. And kudos to women from the RAC who really led this initiative to make it happen. So, and it did. So does anybody have any questions?
Yeah,
thoughts?
I have one question. So when you gave out the bags, did the people who received the bags, did they seem aware of the area agency at all? Or was this kind of like new information for them?
It was new information.
That's
Most of them
great.
had no idea.
That's
So
great.
yeah. So we gave out the yellow books. Yep. Yeah. So the yellow books went in the bags, and it was just, yeah, people had no idea. So they were grateful to have heard about the resources and just know, because they had no idea.
Great. I mean, that makes it really successful.
Yes. Yep.
Congratulations.
Yes. And we do have 5 bags here at the AAA that we want to give out. We have names of 5 individuals to get them to. So if I have anybody, you can be thinking about this between now and the end of the meeting, who wants to come by and pick up 1 bag or all 5 bags and make a delivery to people's homes. Again, we have 2 folks that are living in a mobile home park, and then 2 folks in the 80906 zip code area and 1 in the 80907. And I'd really like to get these distributed today or tomorrow. The fire department has also volunteered to make those deliveries, but if we have any RAC members who want to stop by and grab them and deliver them, let me know at the end of the meeting today.
Great. Thank you
That's it.
very much, Melissa.
Yep, you're
This is
welcome.
very exciting to have this project pulled together, and looking forward to it happening again in the fall. So we will go ahead and back up to introduce Jessica Griffin here with the Denver YMCA. And so whenever you are ready, Jess, thank you for being with us today.
I'm getting her to share her screen, so hold on a second,
Okay,
Jess.
great.
No worries. Thank you. Yes, thanks for having me join today. I'm with the YMCA of Metro Denver. I'm here today to talk a little bit about our diabetes prevention program. So before I have a lot of slides, and I can go really into detail or keep it high level. And I was just curious if there is anyone who is familiar with the diabetes prevention program. Maybe just kind of raise your hand if you know about it. Okay. So, and I can't see the people in, I think there's some people in the other room, but it seems like maybe half are familiar and half maybe aren't. So I'll do an overview just so that we all can be on the same page. And then I'll share some ways to connect with us. We do offer the program virtually, which I think is going to be especially relevant for the people that you're serving. Okay, so let me see if I can share my screen. Let me get it into present mode. Is anything coming up? I see black on my end.
Yeah, there was something before, but
Let's see.
disappeared.
Let me try that one more time. Let me try one more thing. Well, for some reason, it's not letting me pull it up in the full screen mode. So we'll just do it this way. I know this isn't ideal, but can you all see this middle slide here? Okay,
Yep.
we'll go with this then. Thank you. Sometimes technology doesn't always cooperate. So again, I'm with the Denver Metro YMCA. I'm part of our health and well-being team. Today, we're going to kind of do a deeper dive into the diabetes prevention program. But I do want to share just this slide here that says prescribe the why, just to give you a larger understanding of what we're offering. Some of this may not be relevant as it is sort of center specific up in the Denver metro area, but a lot of the things that we offer can be accessed virtually. So we are doing a lot to bring our evidence-based community health programming out to the community. We have a blood pressure self-monitoring program that is designed for people who are at risk for hypertension or who have high blood pressure. So we are offering that program currently in our wellness centers. That one's great to just give people the skills to be able to monitor blood pressure at home and to learn the nutrition components that go along with keeping your heart healthy. Some of the nutrition components are available for free virtually. So I will be sure to share links to those that are upcoming. We also have a nutrition team on staff, a registered dietitian and 2 nutritionists. And we just recently hired a Spanish-speaking registered dietitian. And they do consultations both in person and virtually. So that's something else to keep in mind if you're ever running into people who are looking for some additional nutrition information. Live Strong is our cancer survivor program. Weight loss program is only offered in person currently. That's a 12-week program focused on healthy habits around weight loss. And again, just the community at the Y, trying to get people to learn how to come in and use the fitness equipment in a way that they feel safe and included. So moving along just to the discussion around diabetes, the YMCA's diabetes prevention program is a prevention program. So this is not a self-management program. This is designed for people who are at risk. And as we can see in this slide, the risk is this big, huge iceberg under the water that sometimes goes unnoticed. The numbers have shifted since COVID. I've pulled these statistics from the CDC, and these are the updated statistics, and they went up. So in Colorado, about 34% of adults have pre-diabetes. So that's 1 in 3. And the startling thing about that is most people have no idea that they have pre-diabetes or that they are at risk. So, you know, we're doing the best we can to partner with healthcare providers. If you are all connected with healthcare providers, if you ever want to connect me to them, I'm happy to do this presentation. I do it a lot for our providers here in Denver, just so that they know when they're coming across people who maybe haven't come in a long time and get their lab work done and see that their A1Cs or their blood glucose levels are a little bit elevated. We want to make sure that we connect them to the program so that they can start making changes. Just briefly, the program, the diabetes prevention program that the YMCA offers is based on research from a couple decades ago that followed groups of people. It was a research study that did a lifestyle intervention and then compared that with a placebo group and then a metformin group, which is the standard of care currently offered for those who are at risk for diabetes. And what came out of that research is lifestyle changes really work. So changes to diet, changes to exercise, you can reduce the risk for diabetes by 58%, which outperforms the medication. And for older adults, up to 71%. So we know that this works. We know that the research supports making lifestyle changes and having that opportunity to reduce the risk for diabetes. So we follow a national curriculum. We have trained lifestyle coaches. We do offer the program in person, and since the COVID pandemic, we have also offered this program virtually. So we're able to do both, and we're able to do both for the foreseeable future. That might change. So we're trying to do as much as we can virtually so that we can improve access for those that need this program. We emphasize participant empowerment. So it's not a prescriptive diet or anything like that. It's really just a supportive curriculum where people come together in a group setting and they get to learn the strategies and skills to build a healthy lifestyle, and the goal being to lose weight and learn how to be active so that they can achieve that 58 to 71% risk reduction in diabetes. So this picture here is really reflective of what we do in class. I'm one of the coaches as well. It's really discussion based. It is really supportive. It's group led. So there's no lecturing by the group facilitator. It's really driven by engaging the group together to share information, to process the information together, to share with each other what's working, what's challenging. and really to build that group rapport so that people who enroll in this program get to feel that support and accountability each time they meet. So the format of it is a full year, which sometimes scares people away. But the most intense part is just the first 16 weeks. So we meet weekly for 16 sessions. So if we've got people who are participating virtually, it's a Zoom call once a week for an hour. And that schedule is set out so people can plan ahead and make sure that they can attend all of the sessions. And then the rest of the program, the last 10 sessions, are delivered over that 6-month period after the first 16 weeks. So you get a full year of support, but the most intensive part is that first 4-month period. So the first 16 weeks, these are some of the topics that we cover. We encourage folks to learn how to read food labels, how to look up calories. We focus on fat grams as a way to lower the fat in the diet. And again, all of this is based on the research study. So we also talk about healthy eating, what that looks like, what that means for people. And of course, depending on people's experiences and cultures, it could be different. And so we really like to help people find their way from where they're starting. We talk about healthy ways to eat out, if you go on vacation, if there's disruptions to routines, mindset. So it's a very holistic approach to lifestyle change. We've been doing this for a while at the YMCA of Metro Denver. Since it's been about 7 years that we've been delivering the program, we've served over 1,000 people through this lifestyle change program. We do surveys regularly to just make sure that we're still meeting our benchmarks. And as you can see here, the percentages are high. People are learning to reduce portion sizes. They're learning how to increase physical activity in ways that make sense for them and their lifestyle. There's improvements to overall health. And just anecdotally, as a coach, I've led this group, cohorts. Each group is always so different, but there's always just amazing success stories that come out of people. Everyone kind of knows that it's important to eat healthy and it's important to be active, but it's hard to apply that in life sometimes. So just having that support, having the check-ins with the coach, with each other. I've just heard so many amazing stories, aside from seeing blood glucose numbers go down back to normal range. I see people who lose weight and then they can do things they wanted to do before, like hang out with grandkids, go hiking, travel, feel better in their clothes, have more energy. All of a sudden sleep is getting better. And then now that sleep is getting better, certain other things are getting better. And it's this ripple effect, which then also spills out into the community, which is really cool. Like sometimes people will say, my friend really needs to get in this class, or my neighbor, or my cousin, really got inspired by my journey. And so all of these stories are just amazing, and it makes doing this work so awesome. Just going through why the YMCA is a good partner for this type of work. We are trusted in the community. We are seen as a trusted place for people to explore physical activity and healthy living. Again, all of the program is evidence-based and it's recognized by the CDC. We have a recognition status for the next 5 years, which is really gold standard. So that means we are really, implementing this program as it was designed. We offer feedback to clinical groups that send referrals. The majority of our participants do come from physician referrals. So that's one area that we're really trying to continue to make connections with. Just making sure that physicians know that they can send their patients to us and that we will take good care of their patients and help them find the success that the physicians also want for these people. One thing to note, we are a Medicare supplier. So we've earned that recognition. We are able to work with Medicare, and Medicare does cover this program. It's a one-time benefit for Medicare beneficiaries. So we work with Medicare, we bill Medicare, and we take, there's a little bit of a different approach when it comes to making sure that people qualify under Medicare, but we handle all of that. So all we need to do is just, get connected to wherever the participants are coming from, and then we bring them through the enrollment process and make sure that we are working with their insurance. We also have grant funding from the State Health Department, from PPACG. We have 1 more year of funding. So if people don't have Medicare, I know a lot of people have Medicaid. Medicaid doesn't cover this program currently. We're trying hard to continue those conversations to move that forward, but currently Medicaid does not cover prevention in diabetes. So we have grant funding. So we will help anyone who is eligible for this program to get connected, and we will cover the cost. So we just want to help as many people as we can who are at risk so that we can start chipping away at that huge iceberg that we saw on the previous slide.
I have a question. I don't know if
Sure.
I should I wait or can I do it now?
Go for it. Yeah, go
So
ahead.
when you said Medicare, is it regular Medicare or is it Medicare Advantage?
It's Medicare Part B. And it depends on the plans. And a lot of times what we'll do is we have Medicare billing is like a beast. So what we've done is just anyone that has a Medicare plan, give us a copy of the card. We have a person on our team who has been handling the billing questions. And so we check it. And if for some reason it's not the right Medicare plan, we will use the grant funding. So there's a backup funding source.
So are you able to get Medicare Advantage plans to pay for this program, or is it mostly regular Medicare?
Debbie, these questions are excellent, and I don't have the answers right now. I can look it up. I know Medicare Part B for sure, and I've seen Advantage plans in our system being billed. So I think the short answer is yes, but there are nuances to that.
Okay, great. Thank you.
Does that help? I can get more information too.
Yeah, no.
And so this eligibility here is really when we're speaking with clinical groups, there's some, glucose levels and things like that when providers are referring, they need to pay attention to. But really for this program, it's 18 and older, having a BMI, which is a body mass index of 25 or higher, which basically means, for your height and what your weight is, the category of 25 is overweight. So the program really does work on the risk factor of weight loss. So we want to make sure that people do have a starting weight that has some weight to lose. And then again, you cannot be a type 2 diabetic. This is not a management program. This is a prevention program. Let me just get to the next two slides here are really aimed at the provider communication. So if there's clinical providers who are sending us referrals, we have a secure way to receive referrals. Usually we set up an agreement called a BAA with clinical groups so that we are both protected in exchanging patient health information. So we have all of those in place. And we are also able to send information back to providers on where their referrals are going. Are people enrolling? Are they not answering the phone? Are they declining? So that physicians have that information for the next time that person comes into the office so that they can have a continued conversation. And again, we're really hoping to start more upstream so that we can work on this prevention, help the clinical community. They are working so hard all the time with their patients, and we know that these programs work if we can have access to potential participants and let them know that this is out there. So this last slide has my contact information. My last name is Giffen. There's no R. It happens all the time. People think it's Griffin. So I just want to point that out. If you are trying to email me, there's no R. It's jgiffen@denverymca.org, and I'll put it in the chat also. And I just wanted to share a flyer that I'm happy to email after this that does indicate we do take Medicare and we do have a virtual option. So this is our flyer. I'm happy to share this if it's helpful in your work with spreading the word out in the community. This QR code is new, but a lot of our participants and especially our seniors are getting used to doing all these new tech things. The QR code brings you right to our website where there's more information. But all of the key contact information is down here as well, the phone number and the email address.
I have one other question. So who are your biggest Medicare, referrals from, like UC Health, or, where do you get most of your referrals?
Yeah, that's a great question. We're building that. That's part of my role on the team, is to continue building these partnerships. So if you all have access points and you see a good connecting, let me know. But currently it's Rocky Mountain Primary Care has 17 locations, and they have been an excellent partner. They just did a data pull in their system. So they went through and kind of filtered out people who had elevated A1Cs and who also had Medicare Part B, and also had a few other things, and had their providers kind of look over it. And then they sent a letter to all of those patients indicating that they were eligible for the YMCA's program. And then our team did some extra outreach to make phone calls and just, hey, did you get the letter from your doctor? You know, we're here for you. We just want to explain what the program is. Our recruiters are incredibly skilled at having really good conversations with the public in ways that make people feel comfortable. And you know, sometimes getting phone calls from random people is not what people want, but you know, we try our best to just make sure we just want to let you know this is a resource and we're here for you whenever you're ready.
So the local Y here in Colorado Springs is not doing this program?
They were in the past. There has been so many changes since the pandemic. And so since then, it's my understanding that the Colorado Springs, the Pikes Peak Y is not currently offering the diabetes prevention program. And it's a lot of times because you need a staff person who is trained to do this program, and the training, if staff turnover happened down there and that person left, it takes a while to get someone trained. And so I know that the leadership on our side has been in continued conversations, but to my understanding, the program is not currently being offered, which is why we have the virtual option. And you know, that's been a great resource for folks. We do work with Sunrise Healthcare down in Colorado Springs, and Dr. Nowicki has been sending some referrals, and we've gotten some of her patients connected. So that's been great.
Great, thank you.
Well, thank you, Jess. Any other questions for Jess?
So I do have a couple questions.
Great.
This is Melissa, sitting in the PPAAA rooms here. And so Jess, if we know individuals, older adults who are interested in this program, we need to encourage them to go to their doctor first and have their doctor kind of run those screening tests and have that information kind of ready to go before they reach out to you guys. That's kind of the best plan, right?
Yeah, and that's a good point. I think it could go either way. If they want to use their Medicare coverage, Medicare requires some sort of lab value within a year. So if they've been to the doctor within a year and they have a lab value, they can connect directly with us, and we can work on that. And if there's anything that's needed, we can also work with their physician. But if they haven't seen a physician, or they don't know their numbers, it might be a good idea to have them go the route that you suggested, if it's accessible to them.
Great. And can people sign up anytime? So like these virtual classes are happening. If, you know, somebody signs up, you know, this month, are they just kind of jumping in at, you know, class number, you know, 36 and then moving forward from there? How do you guys coordinate that if people are kind of jumping in at any time, any day?
Yeah, and it's that's a good point you're bringing up. It's actually cohort based. So we don't start until we have a minimum amount of people, which is usually 10, and we can have up to 18 in a group. And so once we have enough people in a group with a coach, we start them off on their journey, and they go and they do the whole 25 sessions together. So there's no jumping in and out. You have to start at 1 and go all the way to 25. And you do that with the same group of people and the same coach. So it does take a fair amount of coordination, as you can imagine, to kind of, you know, do, and then the in-person groups are different too, because they're all geographic based. So we have to have enough people in a geographic area who can commit to the time and the place. So, you know, the virtual option is more flexible. And we do require kind of that enrollment period. And then once we have everybody ready to go and we have the start date, then they fly, and then we kind of start the process over. So currently we have one more group starting in June, and then we are taking July and part of August off to kind of reconvene and get set up for the fall. So the next virtual offering will likely be at the end of August, early fall. So we have some time to spread the word. We have some time. If somebody next week you find that they should be connected, you can connect them to us, and we will reach out. We will talk to them. We'll explain that the class is not starting till the fall. We will offer opportunities for them to kind of get engaged with some of the other free virtual things that are happening. If there's a nutrition seminar or a cooking class or an article, we'll kind of keep them engaged until it's time to start. But we do need to kind of gather the group and then let them go.
Thanks, Jess. And I do want to just mention that Jen, our RAC member, she's the person who kind of brought your program to our attention. So we're glad to know about that. I'm not sure if the statistics are still true for El Paso County, but I know when I started this job 3.5 years ago, El Paso County had the highest rates of diabetes in the state. And, the fact that we do not have a program like this in our region is just surprising, and that we have to tag along, and do resources in Denver or wherever we can find them is, again, a little surprising, but, glad to know that this is available virtually. I know that there's, other diabetes management programs through the military and some other places in town. But again, I think that our region is sorely lacking with this. So it was great when this was brought forward by Jen. And I think Rosemary also kind of had mentioned it in another conversation too. So a really good resource. So thanks everybody for that.
Yeah, and Melissa, are you connected with anyone at CDPHE? There is work being done at the state level, on looking at what is available, where are the gaps. I know those conversations are always happening.
So I wrote down CDPHE when you said that you guys had a grant with them. So I did write that down.
I have a contact if you're open to having me connect you. Her name is Monica. She is the Diabetes Prevention Program Coordinator for the state, and she is an amazing resource and an amazing person. And I'm happy to connect you if that would be
great.
helpful. Okay.
Yeah, thanks.
Cool. Thanks, Jen, and thanks, Rosemary, for the connection. It was really nice to be here. I really appreciate the time. And if you need anything, if you've got questions, let me know.
Thanks so much, Jess. I appreciate you doing this.
All right. Thank you very much for that presentation. We appreciate that. All right. We're going to continue moving here. Next, 5C is our Strategic Review Subcommittee with Jen. And I'll let you go ahead, and then I'll kind of backfill with you.
All right. I don't currently have an update. We're just still in a holding pattern, waiting for the next round of plans. So that's kind of where we're sitting at this point.
Yeah. So the part that I was going to also share to fill in with that is we did expect to have the area plan draft or area plan policy directive, which effectively gives us all the directives, the direction, the documentation, timeline, expectations, all of that around our 4-year plan. But that is still at the drafting level with the State Unit on Aging. So Jen, as soon as we have it, you'll be the next person to have it. So for those of you who haven't or aren't aware or aren't familiar with the area plan or the 4-year plan, those terms are used interchangeably. So if you hear one of those, we are talking about the same end result. The 4-year plan is essentially that it's collecting information, data, going out and visiting communities. We will put on what are called community conversations. Those will be across all 3 counties. We'll work with a variety of providers and partners across the 3 counties to put these on. And these are not huge events. Think of this more as a strategic planning type scenario where you want to really strategize the people who are in the room, who could speak to the questions, who can speak to the conversations. And so, like I mentioned, that will be a mix of individuals as well as partners. And so the community conversations, along with a statewide survey that will be going out, will all be incorporated into what is called the area plan or the 4-year plan. The report that we put out, it goes to the State Unit on Aging. The state compiles our report with the other 15 AAAs from across the state of Colorado, and that ultimately goes into the statewide aging plan, which then is used as part of funding discussions and legislative discussions. And so it is a mini strategic plan, I guess you could call it, for a 4-year period. What we did in the last plan, and I was actually on the RAC as a member previously when the most recent one was put together, and we established the strategic review subcommittee in order to ensure that the plan wasn't just literally put on a shelf and not touched until the next time it was time to do a 4-year plan. And so Jen has been leading those discussions with staff and other other RAC members and other staff members. And so if you are not on that committee or not serving on a committee right now at all, we would love to have you a part of that. And you can get in touch with Jen and Melissa to indicate interest in that. We will be planning to go out to Teller County and Park counties once we have the directive in hand and know what the expectations are. And so, if you're up for a road trip and joining us to go up the hill, we will make a day of it. And so this will probably be, it will be something that as soon as we do have the policy directive that we'll need to move rather swiftly on, because it is one of those projects that you really want to get started and be doing portions as soon as possible and as regular as possible. It will be due to the state at the end of March this coming spring, and so we will have a lot of work to do, but there are a lot of us contributing, and so I know it will go as well as can be. So thanks, Jen, for taking the chair position on that and leading that discussion when the time comes. So we'll keep you posted.
Thanks, Jody.
Certainly.
When is the 4-year plan cover? Does it go like June 2023 to like June 2026, or is it 24 to?
Yeah,
it
effectively follows the state fiscal year, so it'll be July 1 of 23 and 4 years out from there.
So till 27.
Correct. So
Right.
so this current area plan that we're under expires June 30th of 2023. Yeah. All right, moving right along, 5D, that comes to me as a director's report. And so just wanted to bring you up to date on a few items. The 22-23 TRS and RAC funding recommendations were presented to the board earlier this month, and those were passed. There were a few questions and a few areas of discussion, but nothing that held up the process. And so for those of you providers that are on with us this morning, be watching for an email today from Melody, excuse me, and be watching for that around getting access, around updating your contracts. We are still shooting for July 1 contract date, and so far we are on track to meet that. So it may be tight, so please jump in there. She has provided very specific step-by-step directions for you. So if you have any questions, please reach out to her as quickly as possible. And those updates will be due June 3rd, which is next Friday. There is still a question about the actual funding, as we've discussed over the last couple of months, due to the federal continuing resolution. Budgets were just finalized. We don't have the actual contract yet with the state. Normally it's an option letter. So those of you who have heard me talk about this before, we're under a 5-year contract with the State Unit on Aging. And every year we would normally get an option letter. And that's just a re-up of the year to year of the contract process. This year it'll be a full contract because there is an adjustment of a county moving from one region to another out in our western part of the state. And so they have to reissue that as a contract, which is a far more complicated process than an option letter. What it also tells us is we still do not have our final dollar amounts for allocations. What we've decided to do on this in order to keep our schedule moving forward with contracts with our providers is that once we do have that final number in hand, we will not be making adjustments to contracts right now. If the amount is lower, we will adjust contracts accordingly, proportionally, based on the final number. If it is higher than our working number of 5.4 million, which was the flat funding we were told to expect, but if it is higher than that, we will put that into reserves and plan to distribute that in Q3 or Q4 of this calendar year, which is effectively the first 2 quarters of the contract period. So we will look at redistribution or distribution of that balance a little bit later down the road, because we can do that as a contract amendment and not hold up our current process. So a couple of announcements I wanted to share. We have run out of yellow books here at the Area Agency on Aging, which is exciting. But you know, if I give you some context, we ordered 10,000 and only took 1,000 here at AAA. We were able to, working with our printer, we added to the contract distribution of the other 9,000 directly out to a dozen providers across the 3-county region. And so if someone is looking for yellow books right now, please refer them to the Pikes Peak Library District. They are distributing amongst all of their libraries. The Colorado Springs Senior Center also received a large shipment, and Silver Key Senior Services. I'm sure they'd love to see people walking through the door, but Silver Key did receive, they were the 3rd agency that received the largest allotment. There are also, for folks who see their doctor at Mount Evans on Fort Carson, there are yellow books there. They are also up at the VA Center. And others. So if someone is looking for a yellow book, please feel free to let them know. It's probably right at hand with one of their regular life stops. What we are doing, though, if someone calls and does not have access to any of those, we are making a list of names. And when we receive our next shipment, which we have already ordered, we will begin distributing those. We may call on you RAC members, much like we did back in 2020. If you would be open to taking a case or two and a list of names and addresses and distributing those individually, you can tell us what your availability is for zip code and that kind of thing. And that worked out really well because we had folks who had, you know, by that time it was May, it was probably April. No, we received our books in May, so June. So people have been at home for quite a few months, and so it was such a blessing for them to actually see someone in person, get checked in on, and receive the 2020 book at that time. So we will probably do something very similar, because shipping those yellow books is extremely expensive, and we want to make sure that we're making good use of our program dollars. So if you are interested in taking on or being part of that, please feel free to reach out either to myself or Melissa, and we will get you on the list for that distribution. So, and we appreciate that up front. So thank you very much. A new thing is we have been in the process of translating a variety of our materials into Spanish. And so the yellow book is now being printed in Spanish. It's at the printer, along with the reorder of English yellow books. And so we'll have the yellow book in both English and Spanish. Our Medicaid VA guide has been translated and will be printed in a small volume, excuse me, but also in Spanish. Both of those Spanish versions are available on the website. And so if anyone is looking for that, they have immediate access to that, even if they don't have access right away for the printed version. We have a couple of other things that I was able to participate in this last month. Teller Senior Coalition moved. They moved their offices from Woodland Park out to Divide, and so hosted an open house here recently. I was able to attend that, and who should walk down the hall but Maria Cordova from the Independence Center. And so it was a real treat to catch up with her and get to know her more at lunch, and get a tour of the Teller Senior Coalition offices. And so if you have opportunity, you're through that area, please stop in. It's just night and day from what they've had in the past, and they have so much room, and they're filling it fast with staff and services. So it's really a lovely space, and so excited for them to have that. We also, several weeks ago, Melody and I went out to visit Jenny in Park County. We met up in Lake George and got to visit with her and hear more about the freezer project. Some of you may have heard of the freezer project. This was a project that Jenny worked on with some of the CARES Act funding that she requested for Park County. She's putting, remind me, is it 5 or 6 freezers across the county? I know you have 2 in place right now. Your mic isn't. We're not hearing you. Just hold up your hand. Was it 5 or 6? 5. Okay, great. So 5 freezer projects. And so she has 2 in place, 1 in Bailey and 1 in Lake George. She's got a cohort of volunteers who have access to the buildings that they're in. The buildings, the space in the community centers and firehouses are being provided by the county. And she's able to store frozen meals in those freezers across the county to make it easier for people to access emergency food provision. And so we're really excited that that's coming along, and will be in place fully by winter time. And so, Bill Bowles doesn't have to go over, from Lake George over to Fairplay if he wants to pick up a meal for a neighbor or something. So we're really excited about that and what that's going to mean for Park County. So good job. We're really excited about that. And it was exciting. I'm afraid I took a very boring picture, so I'm not going to show it. So, those are the kind of stories that I've been sharing when I meet either at the state or the federal legislator level, when we talk about what we did with our COVID emergency funds, or our CARES Act funds. So really excited to be able to share that. Last couple of things. June is going to be a busy month. June 15th is the Silver Key Senior Summit. That runs from 10 to 3:30. There is a benefit breakfast at 8:30 if you're interested in that. We will, in fact, what we'll do is we'll send out information on that with the link. They are asking for registration even for the expo portion during the middle of the day. I will be there across the day. I'll also be speaking from the perspective of the AAA director and more about our funding, how it comes through the Older Americans Act and Older Coloradans Act, and how that gets into our region. And so if you need that after lunch snooze, come see me at 1 o'clock. I'll be presenting then. We also have our regular presenter, Josh from the Social Security Administration out of Denver. He's going to be presenting on Social Security 101 at the 1 o'clock hour as well. And so we're really excited to be able to participate in the Silver Key Senior Summit. That is Wednesday, June 15th. Wednesday, June 15th at the Antlers Hotel. Melissa will get out, we will get out the link for how you can register. I believe there's both a phone number and an online way to register for that. So at this point, I believe the last number I saw was 70 plus vendors where people can find information around resources and services across the city. So looking forward to that. June 16th, the very next day, it's all aging all week. So June 16th, Thursday, also at the Antlers Hotel, will be the Strategic Action Planning Group on Aging's Future of Aging Conference. This is something that's never been done before. It's something that was they started discussing this before COVID, and obviously that put a halt on things. But if you're interested, that's also a free event, but they do ask for registration. So we can include that in the email that we send out to all the RAC members. If you're interested in that, I would highly recommend that you attend in person. There is a virtual option. I will be attending virtually portions of the day with my Colorado Association of Area Agency on Aging board members, because we already had our 2-day conference scheduled. So I won't see you in person on the 16th, but please do plan to go if you're available. And it's I believe it's a pretty long day. It's like 8 to 4, but the flyer will tell you more. And then Friday, June 17th, the Area Agency on Aging and the Ombudsman team here will be hosting the World Elder Abuse Awareness Day. And so as we have more information and a flyer is being worked on now, we will include that to the RAC members. It will include lunch donated by PACE. So if you see someone from PACE, thank them for that. But if you are interested in attending or bringing someone, we will ask for registration on that so that they make sure that there are plenty of box lunches available. So the last thing I want to mention is, as you might remember, the last meeting I was at, I mentioned I would be scooting right up to Denver to testify on the senior homestead tax exemption bill that was being reintroduced. Unfortunately, it was voted down 3-2, but Senator Liston and Senator Janal are planning to bring it back next year. What I would like to do, I learned a lot that day. First of all, don't go in hungry. It's a long day. And just because they tell you it's at 2 o'clock doesn't mean that's when you're going to be testifying. But seriously, what I want to do, and I have also shared this with our Commission on Aging members, is that for all intents and purposes, I get paid to do that. You know, that's my job. My job is to advocate. What I want to do is future opportunities is to take one of you with me. And that is hugely important, because the one thing that I noticed across the board with all of those testifying, both in support and in not supporting the bill was we didn't hear from the people who are actually going to be affected by that bill and what that truly means. There were loads of statistics thrown around. There was plenty of political pandering going on. But at the end of the day, there was no one at the table, literally or figuratively, because you could either testify in person or remote. But there was not a senior there who would be affected by that vote. And I don't know, but I would hope that could sway the vote. And so you're hearing from me now, even though we're coming to the end of the legislative session. That is my plan, is if there's a particular topic of import to you as you hear us describe what's going on in the legislative session, and if we're invited to testify, I would love to be able to just plan on taking one of you with me. We'll both testify. I'll coach you. We have a what is Dan's title? A lobbyist. You know, he can tell you what to say and what not to say, and you know, how to respond and what to expect. But at the end of the day, I was surprised. I was a little disappointed. There were a lot of great people there testifying on behalf, you know, others like myself who are part of senior services across the state. There were tax assessors. There were others who were all in support of this bill, but not a single senior who could likely be affected. And so we're going to change that. We're going to advocate and we're going to coach. And I would love for one of you to come with me next time. So be ready. So thank you very much. I see the chat. Jason, thank you. Yeah, on Monday, I was able to participate in the Silver Key board retreat with their board of directors. A lot of people in the room I've known over the years, so it was really good to see them again. But really talking about funding, the future of funding for aging services. I hope what I shared was not too depressing, because right now we are just being told flat funding. We don't know what that's going to look like for long term. But there are a lot of great people doing a lot of proactive advocacy on increasing the funding amounts simply because we know our numbers are growing. So Jason, thank you for that opportunity. I'm very happy to have been with you that day, and I will make those presentations in the future too. So if anyone here needs to know or needs a presentation around AAA or our funding, I'm very happy to make that happen. So. If there are no questions, I'm going to keep working through the agenda. Any questions on anything that I've shared? All right. So 5E is the RAC chair report. And so with B's absence, we'll go ahead and pass that. Are there any other items with the board members, with the RAC members around anything that needs to be discussed that's not part of calendar of events? I think we did a good job today with the questions and updates. Marilyn, do I see the beginning of a hand up? Yes, you're on mute.
Yes, I've been participating in a program I'd like to tell the board about.
Please do.
I've been working with UC Health, and they have a program called Aging with Independence and Mobility. It's called AIM as a result. And they contacted me, and because I was on their vaccine list. And it's an exercise program. It's starts at the first of the month, and it's 4 Fridays of that month. And it's been very good. They don't want money. They have money, but they need participants. And if they get enough participation, this will become a permanent part of UC Health and this program. And I would like to send Melissa a copy of what their program is. And if anybody's interested, the phone number is 719-365-2872. What I did not expect from this program was it's safety a lot. They started asking me questions when I first signed up. And they have funding to provide safety things for the individual. So they provide me with a fire extinguisher and smoke alarm and all kinds of things without charge. And I just think this could be valuable to some of our people. Because it's virtual, it would be available for Park and Teller counties, which I thought might be of service. In Teller County, they have one class in person, which is at the hospital, and I don't know what hospital, but I think it's worth pursuing, or maybe having her do a 5-minute presentation.
Great. Thank you very much.
So
We'll watch for that.
So Marilyn, I missed, did you say the one in person is in Park County or Teller County?
Teller County.
Teller County in person. Thank you.
And I don't know how much access the Teller and Park County, their people have as far as computer, but this is all done from home.
Marilyn, I'm sorry, what was the program called again?
It's called AIM, Aging with Independence and Mobility. The good thing, the reason I went ahead and signed up for it is they check back on you. Every 3 months, they check in with you for a year, see how you're doing. And I need that type of backup.
Fantastic. Thank you.
Jody, one other thing I just noticed, when they delivered my items, they had a booklet in there, and it looks like it's just for drivers and how to drive safety. But in the back of the book is a map of all of the AAA regions, and the address and contact point. And I just thought that was interesting that that's been provided as part of this program to the participants.
Excellent. Thank you. Thank you for sharing. All right. Anything else? All right. So moving on, our next meeting will be June 23rd. We will continue to host meetings hybrid. And so at this point, so if you're able to come into the conference room with me, I feel so alone up here. So come and join me. Come sit with me.
And
No
Joe-
pressure. Yeah, no pressure. But just kidding. It will be, will continue to be hybrid. So you are welcome to join us. Melissa, you had something?
So some folks might remember, we were talking about trying to go have our next meeting in June in Teller County. So, and I know Maria did check in with the Aspen Mine Center. They said they had space, they could host in June. So it is very possible that we will be doing a road trip in June. The executive committee, when we met, we had agreed that we would go on the road in June. So
Great. So be
I
watching.
think everybody needs to plan for that.
Okay.
As long as there's not any fires and things that, could potentially really get in the way. So folks plan ahead. We'll try to set up some carpooling for that day. But I think the goal is to get into Aspen Mine Center up in Cripple Creek for June.
Awesome. Thank you. For those of you who are fairly new or came on since COVID, pre-COVID, we did do that. We were out to Teller and Park counties for several meetings across the year to make sure that we could be out there and that their communities would be invited as well. And so it always made for interesting questions and discussion and getting to meet folks out at our outer areas. So thank you for reminding me of that. So I will not be able to join you because I will be out of town myself. So please do watch your emails and announcements as June 23rd gets a little closer. So ultimately, we will also schedule something for Park County as well. And so, Jenny, I would imagine that there'll be some communication with you and perhaps the county commissioners or something like that as we start to work out those plans. So very excited to be able to do that. And then the last regular calendar event is the RAC Executive Committee meeting. That's the first Wednesday at 1 o'clock. That's being held via Zoom right now. So are there any questions or additional updates from the board? All right, seeing none, we will adjourn today's meeting. It is 11:17. This meeting is adjourned. Thank you very much, everyone, for participating and the great questions to our special speaker. We really appreciate each and every one of you. Thank you and have a wonderful long weekend. Bye-bye.
Thank you.
Thanks, Jody.